Okay, folks, back to hunch again, and I'm going to talk a little about the extremities today, and give you a little idea of the major muscles. There's a lot we won't talk about, like the forearm. We're not going to spend a whole lot of time on. We just don't have the time to do that. Plus, it's hard to do without a model because everything is so close. But we'll talk a lot about mostly about the brachium, as well as a lot about the thigh and the calf area, and we'll talk about that today. So the first thing, let's just talk about the brachium first of all. And the first thing that obviously everybody's going to talk about in the upper arm, what we're going to forget about right now, forget about the deltoid, which everybody knows about. But the first thing everybody thinks about the anterior brachium is the biceps, or the biceps brachii. It's called biceps brachii, obviously, because it has two heads to it. Bi means two, ceps means head. And what happens is the biceps brachii actually has a common tendon down in this area. Okay, the muscle belly comes together to create a common tendon. I'll talk about that in just a second, but it has two heads. One head that's called a long head, and the other head's called a short head. Now, if we look over at the image on the opposite side of the screen, over on the right, you see this. Now they've taken away the deltoid, because the deltoid hit a lot. You know, the long head of the biceps is basically the area right here. If I follow with a blue line, this is the long head of the biceps coming up this way. It looks short, and if I do a green line, let me put the green line here. Green line would be the short head of biceps. Okay, well, it looks like that short head of the biceps is longer than the long head of the biceps, but it's really not. Okay, what that long head of the biceps does, okay, is if you remember back when we talked about the head of the humerus, there was a groove in it, that intertubercular sulcus with the bicipital groove. And the tendon, what happens is the long head of the biceps becomes a tendon somewhere, let me get back to blue here, somewhere down in here, okay, starts to become tendinous at this point, somewhere in this area, and the tendon then fits inside that groove, or that sulcus, that goes between the medial, or the lesser and the greater tubercle or tuberosity of the head of the humerus, and then it's covered over. That little trough, or that little groove that we saw, is actually covered over by some connective tissue. So the tendon rides inside like a tunnel, creates like a little tunnel. And then what happens is the long head of the biceps then goes to the top portion of the glenoid fossa, the top rim of the fossa, and attaches there. Well, that's sort of important for a couple reasons. Number one, it's actually a muscle that crosses two joints. You got to remember, it crosses down here at the elbow, and it also crosses up here at the shoulder, because it does go over the top of the head of the humerus and goes to the glenoid, or part of the scapula. So it is a muscle that actually crosses two joints, which is good, because it not only does it, well, I got to get myself in the picture here, not only does it flex the elbow, but also brings the arm up this way. It also flexes the shoulder. So it flexes the elbow and flexes the shoulder, because it does go across the two joints, at the elbow as well as at the shoulder. So it does run through that groove. That groove is going to run right underneath. And you can actually see this white area up in here. Let me get rid of all my blue scribbles down there. I wish it was easy to write that, but it doesn't. Anyway, if I look at my blue scribbles, maybe I could do it with my hand. I don't know. I can't do it with my hand. Let me see. I can. That's even better. So I'm going to be drawing on the screen with my finger. That area right there that's white is actually basically that capsule, like we talked about when we talked about articulations. So that's the capsule. So that long head of the biceps is going to come right up underneath through that capsule. Okay, so let's get rid of that. So what does that short head of the biceps do? That short head of the biceps comes up this way and attaches to this little area right there, which we know and love as called, let me put it in purple, it's called the coracoid. So that's one of those three muscles. The short head of the biceps is one of the three muscles that attaches the coracoid process of the scapula, like we talked about back in the osteology section. Okay, so we have two heads: long head of the biceps, short head of the biceps, that actually provide that biceps brachii, is what we know and love. Okay, so that's the short head and the long head of the biceps. Let me get rid of the green here. Let me erase it with my finger. Okay, see, oh, it's much nicer. Okay, there's my short head of the biceps. How I see it, it's out now circled, and I can actually see that short head of the biceps. Let's do it in purple. Okay, short head of the biceps comes up here and attaches again up to there in that area of the coracoid, which is actually pretty nice. Okay, so that's pretty good. So that's the short head of the biceps. Let's get rid of that. and let's go and let's see what we got next. The next thing we have is going back to the other side now. And you look here, there's that yellow circle, okay? So if I have that yellow circle, let me draw it a little bit bigger here, a bigger yellow circle in here. And basically that yellow circle there is where that biceps tendon crosses. Now, when the two heads of the biceps come together inferiorly, they join, it's very much merged there to one common tendon for a while, and then that tendon then splits. Part of one tendon goes over the top of the other like this. And what that does is when the muscle flexes, it also causes a little bit of an internal rotation of the forearm. Because that tendon crosses over from lateral to medial and medial to lateral, it causes a little bit of a rotation of the forearm. And that's what we see at that area where we talked about down here around the area of the elbow. And I just wanted to point that out now that we're talking about the biceps now. So that's what we see over there. Next thing I have, okay, is there's the coracoid. And again, that coracoid is where that short head of the biceps went up to. So we see the short head of the biceps coming up to that area of the coracoid. Let me do it. Up to the area of the coracoid, like we saw there, okay? Well, what happens is right behind it, okay, let me get rid of that white line here. And it gets hard to see, but right behind, it might be easier to use my mouse here to try to do that. Right behind that, we see a little part of a muscle sticking underneath right there, okay? And a little muscle right there, that's the Corkle Brachialis. The Corkle Brachialis doesn't go across the elbow, but it starts at the humerus, the distal humerus, and comes up, and it goes up to the area of the coracoid process. So the Corkle Brachialis is an important muscle. It's one of those three muscles that go to the coracoid process. That's called the Corkle Brachialis. Let's get rid of Corkle Brachialis, and let's see what we got over here. One muscle that you can't see. You can't see it on the right side. On the left side, you can see just a tad. You know, let's say, oh, look at that. That's just a little small little piddly thing right here. And then you can see it's pointing to that little triangular or that little area right in there. And that area is called the brachialis. Well, guess what? If I pulled that biceps off there, the brachialis is quite large. It's a big muscle. It sits underneath the whole belly of the biceps, and it attaches below the elbow, but it doesn't go above the shoulder. It just attaches from the humerus and to below the elbow. Now, people, you see a little tad of it there, say, oh, can't be much. Nobody talks about the brachialis. Everybody talks about, oh, look at those biceps, and see those biceps bouncing on the guys and you know, popping their elbows up and stuff like that. And what happens is the brachialis is probably as strong, if not a stronger flexor of the elbow than the biceps. It's quite strong because it only goes across one joint. Muscles that go across two joints do lose a little bit of strength because they have to divide it between two joints. They're very powerful, but they have to be powerful muscles to start out with. But basically, by going over two joints, they sometimes need something else to help them. Okay, and that's where the brachialis comes in. Brachialis is a very powerful elbow flexor, and again, you can't see it a whole lot there, but it's going to be this whole area that sits down in here and underneath the whole body, whole belly of the biceps. So that's the brachialis that sits down in there, and I think that's a muscle that you probably should know, but you don't see much of it because the biceps is sitting on top of it. Okay, so that's the brachialis. What else do we have here? Well, what I wanted to show you here on this picture are a few of the other things that we talked about before. We talked about the Pectoralis Major coming in here, okay? And we talked about how it comes from the anterior portion of the chest, okay, and comes across over the top of the humerus. So you actually see it where it's this over here would be lateral, this would be medial over here. So it's coming across over the top. They've actually cut it and pulled it back, and that's why what happens is a great muscle to bring the arm across in front of the body. We talked about how when Joe Thomas got injured, you know, playing football, his arm got jacked back, and when it does that, it rips the pectoralis major muscle. Then usually has to be sewn and stuff like that, which is a real pain in the neck to be able to do. We also see down in here the Latissimus Dorsi. We talked about the Latissimus Dorsi, how it actually is a large lower lumbar muscle, and what it does, it comes underneath the armpit and comes anteriorly. So we're actually seeing right in here where that Latissimus Dorsi is coming from posterior to anterior to attach to the humerus down in this area in here. So it helps to bring the humerus down. It sort of like helps in the adduction process of the humerus, and that's what that Latissimus Dorsi does. So let me get rid of the Latissimus Dorsi right there. And then we have the Teres Major. Okay, now the Teres Major we also talked about in the last video. It starts at the one portion where it's attached to in the bone is at that inferior angle of the scapula, right below the teres minor. But the difference between the teres minor attaches the posterior aspect of the humerus. The teres major actually goes up underneath the axillary region and comes to the anterior portion of the humerus. As a result, has a little bit of internal rotation, but actually helps to stabilize the arm. So that's where we see the teres major coming across. We also see in here the area, there's the subscapularis. Subscapularis I think is also one of those muscles that we don't pay a whole lot of attention to that we should. It's a common muscle injured with throwing sports, okay? And what happens, we know it's on the anterior surface of the scapula, and what it does is it runs underneath it's right between the chest wall and the scapula. It's on the subscapular fossa, and it comes anteriorly and attaches to the, hard to see right here, if I pull it down, attaches right up in here in the front of the area of the humerus, which makes it a good internal rotator. In college, I played baseball and I was a catcher, and one of the things I always liked to do was look at pitchers. I did a kinesiology project in college in regards to pitching motions, and one of the two muscles of the rotator cuff that are most commonly injured are the supraspinatus, because the arm is held out this way to be able to make a pitch, and the second one is going to be the subscapularis, and that's as the follow through the arm came through this way, and that muscle would frequently be injured or torn or ripped or stretched or stuff like that, and would cause a problem with the rotator cuff injury. Okay, so that's the subscapularis that we see right there. There is again the Pectoralis Minor, and I put that in there in blue as compared to yellow. Why? Because that's the third muscle that attaches the coracoid. Three muscles: short-headed biceps, Corkle Brachialis, short-headed Pectoralis Minor. Pectoralis Minor, Corkle Brachialis, short-headed biceps. Those are the three muscles that attach to that coracoid process, which we saw right up in that area. Okay, so let's see. I think that pretty much. Oh, we got another one. Let's see. That's about enough we need to talk about here. Okay. Let's go to the back of the arm. When we talk the posterior aspect of the brachium, the thing that dominates back there is obviously going to be the triceps. Now, biceps was called biceps because of two heads. Triceps is triceps because it has three heads. Okay. Now, it's a pretty broad muscle, and there are three distinct heads to it. The one head, which we're going to see here, the first one we're going to show you right here, which is called the long head of the triceps, actually crosses two joints as well. It crosses the elbow and it crosses the shoulder as well. Where that biceps attached and went over the top of the head of the humerus, the top portion of the glenoid, the long head of the triceps actually goes and attaches to the lower rim of the glenoid fossa. Sometimes people will actually have what's called a Vulcan fracture, where with certain injuries, it actually pulled that long head of the triceps and pull it away with a little chunk of bone, which is called a Vulcan fracture, and that's from the inferior rim of the glenoid. So we actually see that long head of the biceps. If I was to draw a picture of where that long head of the biceps is, that's it right here. That's the long head of the biceps, sitting right in here, and it's going right to the area where the inferior aspect of the glenoid, which would be up in here. Okay, so that's the long head of the biceps. We also have on the other side, let me get rid of my long head over here, we have the lateral head of the biceps. And the lateral head of the biceps is this part of the muscle in this area over here. The lateral head of the biceps does not go above the shoulder. It stays in the humerus, in the posterior lateral aspect of the humerus. That's why they call it the lateral head of the biceps, okay? So that's the second head. So we have a long head of the biceps, a lateral head of the biceps. I'll give you a guess at the third. Sure, of course, I heard you say in the background, medial head of the biceps. The medial head of the biceps you don't see here. You know why? Because it's underneath the rest of the, excuse me, why am I saying biceps? Medial head of the triceps. So we have our long head of the triceps, my lateral head of the triceps, and my medial head of the triceps sits here underneath the long head of the triceps, okay? So that's what we find with the triceps. Long head goes across two joints, that goes up to the inferior aspect of the glenoid rim. The lateral head of the triceps attaches the lateral portion of the humerus, and the medial head of the triceps attaches underneath the area of the long head to the medial aspect of the humerus, okay? And those are the three heads of the triceps that we see. Again, there's the medial head of the triceps sitting below, what you see there, below that area of the long head of the triceps, okay? Now let me get rid of this right here, all this garbage. I point down here, and that little area where the circle is down in here is basically the area of the olecranon. Now we know the olecranon is that bump at the, on the ulna that sits back up posterior to the elbow. And what happens is all the triceps, the heads of the triceps, come together and they merge at that point into a common tendon. You can actually see that common tendon sitting right in here, and that's what attaches to that area of the triceps. When you feel the back of the elbow, you'll feel just above the area of the olecranon, it gets a little dense, and that's that common tendon of the triceps that attaches to the olecranon process. And that again makes it a very strong elbow extensor, extends the elbow because it's attaching here, pulling the elbow down. Also, that long head of the triceps will bring the arm down towards the side as well. So that's what we see with the long head of the triceps, the and everything there. So that's all that. There I also show again the Teres Major. Teres Major is again going from posterior, and here you see it at this point. Here it is right here. It's posterior. Here's the inferior angle of the scapula down here, and how it goes underneath that area of the long head of the triceps to go to the anterior portion of the humerus, which is actually pretty cool. Okay, so that's what we see with my Teres Major. We also see up in here. Here's the Teres Minor. Teres Minor is sitting in this area right here, and along with the infraspinatus, it would be sitting right in here. Again, both of them pretty much blend. They're very close together. There might be a little groove between the two, but they blend really close together. And both of them will attach at the same spot at that posterior lateral aspect of the humerus at the area of the greater tubercle, okay, or tuberosity, whichever one you want to call it, in the area of the head of the humerus. And therefore, because they go to the lateral side, you got to make it make sense that they're external rotators. They're external rotators. The last one I want to show in here, let me get rid of all these other markings here. The last one I want to show here, there's the infraspinatus again. Last one I want to show here is the supraspinatus sitting up there. You see it in that supraspinous fossa. And what happens is, again, we talked about this before. When we talked about the individual muscles, it in the class, it runs underneath the acromion. The acromion would be sitting right here. The acromion is sitting right about there. It's going to run underneath the area of the acromion and attach to the superior portion of the head of the humerus. So therefore, that supraspinatus is a very good abductor. Of the arm. Okay, and again, in pitching, because the arm's out this way, to be able to pitch, it has to stabilize the arm in that position, and therefore it's commonly injured along with the subscapularis. So again, if I think about my four rotator cuff muscles: subscapularis, supraspinatus, infraspinatus, Teres Minor. Okay, and there we got it all in a nutshell. Okay, let's go now and shift gears a little bit and go down a little bit to the legs. Okay, where we had biceps in the anterior brachium, and we had triceps in the posterior brachium. The leg says, well, you know what? I'm bigger. I deserve 4. And what happens is in the leg, in the thigh, in the anterior femoral region, we have what's called the quadriceps. Okay, quadriceps means there's 4 muscles that come together. They work together as a bundle. They're a little bit different, but they work together as a sort of as a bundle. And inferiorly, they all have a very common tendon, and that common tendon wraps around the patella, and it goes down below the knee to that area of that tubercle. Therefore, it's a good knee extensor. It extends the knee a lot. Okay, so let's talk about the first one here, and let's talk about the rectus femoris. You know, if you're sitting there and you can actually look at your leg and you tighten your quads, you'll see right up the middle there's a large bulgy muscle right up the middle all the way, and that's the rectus femoris. Rectus is a term like we talked about when we talked about the abdominal muscles. Rectus means straight. Okay, so straight along the femur. If you look, that makes sense. It's going straight along the femur. It's a very straight muscle. Okay, that rectus femoris is important because, number one, it's a very powerful knee extensor. But if you follow the rectus femoris actually goes up and attaches above the level of the hip. I'm probably outside. Let me go see up here. I'm outside the level. Up there I am. Up there. It attaches to the anterior inferior iliac spine, so it attaches above the level of the hip. Therefore, just like the long head of the biceps, just like the long head of the triceps, it's sort of like the long head of the quadriceps because it does go over two joints. It goes over the knee, it goes over the hip, so it's a two-joint muscle. Okay, but it's a very powerful knee extensor. But because it goes above the level of the hip, it's also a hip flexor. It'll bring the hip up. Okay, so as a result, it has like a dual function at that point. So that's the rectus femoris. That's that big muscle that you see in the middle. The next muscle I want to talk about, which is actually another one that is really a cool muscle, is called the vastus medialis. Now the vastus medialis, we actually see just peeking out at this corner around the rectus femoris right there. But actually it's interesting because if I took the rectus femoris, if I cut the rectus femoris up in here and pulled it forward, okay, and the rectus femoris is sort of like very loosely attached to the other portions of the quadriceps underneath it, what happens is the other three quadriceps muscles are sort of bound together, almost like in a very common fascial bag, okay? They're bound together, but three distinct muscle bellies within this fascial bag. They're connected by aponeurosis or a tendinous structure between the two, but they're bound pretty much together. Anyway, this one right here is called the vastus medialis. It's vastus medialis because it's on the medial side. Now, if you take your knee and you put your knee straight and then you tighten up your quads, you might see a little bulge just superior and medial to the patella on your leg, and that's the bulge of the vastus medialis. Now, the vastus medialis doesn't go above the hip, it only goes up and attaches to the femur, okay, anteriorly, and goes below the knee and attaches to the tibial tubercle that would be down in here, okay. It's really thought to be quite an important muscle, okay. And the reason why it's an important muscle is it's a very significant patellar stabilizer. Okay, this is beyond what you really need to know, but I think it's really cool and I like to talk about it. If I really want to have a friend over and they're overstaying their welcome, and I want to bore them to death, I tell them about the vastus medialis and they're heading for the door. Okay, but anyway, that vastus medialis is really important because what happens is the patella, like we talked about in the osteology section, sits in that little groove, that patellar groove or the patellar notch between the condyles that's anterior, not the intercondylar fossa where the cruciate ligaments are, but on the anterior portion of the femur. It's a groove like this, and the backside, so the femur, the condyles come up like this, and the patella, so I'm looking at it straight down, the patella sits like this. So what happens is it's a shallow groove, it's a shallow angle. The patella could go this way, it could go this way. Chances are, if you've known somebody who's had a patellar dislocation, if this is lateral and this is medial, guess which way it went? It went lateral, okay? Almost always goes lateral. About 95% of the time, you find that patella sitting down the lateral side. If it goes medial, that's something really, 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 really weird. Well, the thing that really holds it from going lateral is this vastus medialis in most cases, if it's good. A lot of times what happens if people have what's called a subluxing patella or a chronically dislocating patella, you look at their vastus medialis and there's almost nothing there. It's very small, it's atrophic, it's wimpy, okay? So a lot of times what we do is if somebody had a problem with this chondromalacia patella or patellofemoral pain syndrome, we'd have them do certain exercises, isometric exercises with their knee extended to strengthens the vastus medialis to help to stabilize the kneecap so it rides up and down. If here's the patella like this and here's the femur like this, so the patella rides this way and not side to side in that groove, okay? And what happens is the reason why that's important is that vastus medialis is critical in the last 15 to 20 degrees of knee extension. If that vastus medialis doesn't function in that last 15 to 20 degrees, the patella has a tendency to want to slide laterally. Let me do a different call. Has a tendency to want to go laterally, and it may dislocate. So that vastus medialis is very important in being able to stabilize the patella in that groove, in that notch, that V'd out area in the anterior portion of the femur, so it slides in there normally. Okay. Otherwise, there's not much else to hold it. There's some ligaments that hold the patella this way, ligaments that hold the patella this way, but enough force will cause those ligaments to rupture. So that's the vastus medialis, a very, very, very important one of the quadriceps muscles. Okay, very important. It doesn't get a whole lot of credit, but it deserves a lot more than it gets. The next muscle I want to mention is the vastus lateralis. Okay, now the vastus lateralis we see a little bit on the lateral side. So if the medialis is on the medial side, the lateralis is on the lateral side. So if I'm looking at this here, this is my vastus lateralis right in that. That's the vastus lateralis right there. And basically, it's just one of the other part of the quads. It also does not go above the hip joint, only goes across the knee joint. So it's a good knee extensor. They all work together. You have a huge muscle mass that's extending the knee, okay? Let me give you a little hint on something. Okay, this is a little insider trading right here. What happens is that muscles that have to work against gravity have to be stronger. Muscles that work with gravity don't need to be as strong. Well, if you're standing up, what happens to keep you upright? What do you have to do? You have to extend the knee. So the quadriceps muscles are anti-gravity muscles. They're working against gravity to lift the body weight. So they have to be stronger, and they are stronger than what we'll talk about in a little bit called the hamstrings on the back. Okay, so they have to be stronger. So these muscles are very bulky, they're very big, they're very strong. Okay, hamstrings don't have to work because if I'm lowering my body, the hamstrings will flex the knee, so to lower the body, you could just let go, and boom, you'll fall. Okay, happens to me anyway, even if I don't let go. So anyway, that's the vastus lateralis, another important, very firm part of the quadriceps. Now, where's the vastus intermedius? So we have a vastus lateralis, vastus medialis, rectus femoris, right behind the rectus femoris is the rest of the quadriceps, and it's called the vastus intermedius. So if I was to draw where it's going to be sitting behind the quads, or the rectus femoris, sitting back there between the lateralis and between the medialis. Okay, and again, there's this common broad tendon that connects all three of those in the back, and that'd be called the vastus intermedius. So my four muscles of the quadriceps: rectus femoris, vastus medialis, vastus intermedius, vastus lateralis. Pretty easy to remember. Medial, intermediate, lateral, and rectus femoris, which is the straight one up the front. Okay, couple other things. So underneath the rectus femoris is the vastus intermedius, like I mentioned, sits up underneath in there. Okay, Sartorius. This is an interesting muscle as well. Let me just draw this muscle in here. This muscle starts up here in the hip, comes across at an angle across the leg, attaches, goes down across the knee, and attaches down below the knee down here. It goes obliquely across the angle, across the thigh, from the lateral superior portion to the inferior medial portion. It goes across, okay? And it's called a sartorius because what happens is this muscle is really, it crosses two joints as well. It crosses the hip, it crosses the knee down here. But it's a very thin muscle. It's a very strap muscle. It's almost like all straight fibers. All the fibers are parallel. It's like a ribbon of muscle, okay? And all the fibers are going in the same direction. It's called the sartorius because, and this is what's presumed why they call it the sartorius, because before they had like sewing machines, people who would sew, they'd cross their leg, and that would be like their table. And when they crossed their one leg over the other, they'd sew. Well, what happens is one of the muscles that's responsible for doing that is, our good friend, the sartorius. So maybe when they talk about someone who is a tailor, it was also sartorial. Sartorial means tailoring. So that's probably where the name sartorius came from, another piece of worthless trivia that you could throw out after the class is done. Okay, so that's called the sartorius. And if you see that, those muscle builders and stuff like that, or stuff like the bodybuilders, and you look at them, you'll see that muscle that goes obliquely over the top of the thigh, and that again is called the sartorius. The sartorius. Interesting thing enough, the sartorius then ends and down here and blends with two other tendons, which I'm going to hold off on for just a second. You got to remember it's going from lateral to medial, okay? And right here it blends with two other tendons, and I'll talk about that in just a second. So let me get rid of this here, okay? And get rid of this over here. So that's called the sartorius. The next muscle I want to show you here is the gracilis, okay? This is the gracilis. It's basically another, you can actually see it better on this side. You have one on both sides, and the gracilis is basically a muscle that comes straight up the thigh this way, all the way down below the knee, and all the way down below this way, okay? And basically, it's pretty much of a straight muscle, okay, almost like a ribbon of a muscle. It's a little bit wider and thicker up here where the belly is, and gets a little bit narrower down here towards the area of the knee. but it's part of one of a collective large group of muscles that they consider the groin muscles. Groin muscles, which are basically what we call the adductor muscles. There's a adductor there. There's adductor magnus, adductor longus. There's a adductor minimus, and there's also the gracilis. So these muscles are basically groin muscles, and what they do is they adduct the leg. They bring the legs together. Okay. I know that working with hockey, if I had a kid who had a groin strain, sometimes it involved that sartorius, and man, were they a devil to take care of, because if you're a skater, you're pushing off that inside edge and you're abducting as you're pushing off. So that always puts stress on that. So that's called the gracilis. And I want you to remember the gracilis, and I want you to remember the sartorius for just a couple more minutes. Just put it away somewhere, write it on your forehead, something like that, whatever you want to do. But I want you to remember it for just a couple minutes, because it's going to come back to haunt you in just a second. So that's called the gracilis. Okay, so everybody should know what the gracilis is. Let me get rid of that purple. Get rid of that stuff. Okay, next muscle I want to get rid of that purple there is the adductor longus. And the adductor longus, I don't really want to spend a whole lot of time on the adductors, because it's a large group of muscles that come together. Adductor longus, adductor magnus, adductor minimus, adductor or the gracilis. All these muscles are part of that overall groin muscle group that we talk about. Okay, and they all come together. Okay. One muscle I want to mention here that's interesting is called the tensor fasciae lata. You're going to see it again in a second here. And the tensor fasciae lata is this area up in here. There's a muscle right here, okay? And what happens is down the lateral side of the leg, there's a band that's called the iliotibial band. Ilio from ilium, tibia come down over into here. It actually cuts across. Be better iliofibular band, but iliotibial band, or the fascia lata, okay? And the fascia lata is a band of muscle, and what it does is it helps to stabilize the lateral side of the leg, okay? Especially it holds the muscles together, and it's important. But up in the top of the muscle, up in here, or up on top of this whole apparatus with the tensor fasciae lata and the fascia lata or the iliotibial band, is this muscle that sits up in there, and that's called the tensor fasciae lata. Tensor means to tense, to make tighten. So the tensor fasciae lata is like a pocket-like muscle. It's not really a pocket, but it's right where the pocket would be. It actually tightens up the fascia lata on the lateral side of the leg, which stabilizes the lateral side of the knee and the lateral side of the thigh. So that's called the tensor fasciae lata. They'll show you that, and again, when you look at the lateral side. What else do we have to see here? Here's the gluteus maximus up in here. Okay, if I look at the gluteus maximus, that's this area right in there. I shouldn't be doing that. I'll get arrested. But that's the gluteus maximus. The gluteus medius sits up on the top, and I'll talk about that in a little bit. And underneath it, we also have a gluteus minimus. But we see the gluteus maximus, the large buttock muscle that's there, which everybody calls somebody when they're mad. Okay. Now the hamstrings. In the front, I had the quadriceps. In the back, I have the hamstrings. Okay. The hamstrings have something in common. First of all, they're posterior, obviously, and they're knee flexors, okay? But also what happens is they also will bring the hip back. They also extend the hip backwards, or hyperextend. If you remember back to we talked about motions, they hyperextend the hip because they attach up, they attach, come on. They attach up in here to the ischial tuberosity. We talked about how that ischial tuberosity comes down from the bottom of the ischium, and that's where these hamstrings attach to the bottom portion of that ischial tuberosity. Now, hamstrings I could divide. Let me get rid of, I'll leave that up there. What the heck? I could divide the hamstrings into two. I'm going to draw a black line right down the middle. This is the medial side, and this is the lateral side, okay? So the hamstrings, there's three muscles. One lateral, two medial, one lateral, two medial. So what are they? Here they are: semimembranosus, biceps femoris, and semitendinosus. I wish I would have done that different. I wish I would have done biceps femoris first and then semimembranosus and semitendinosus. Why? Because it's just, the old man was thinking poorly when he put that together. This one right here, this one here in blue, okay, is called the biceps femoris. Biceps femoris, okay? It's the large muscle. Now, if you feel behind your knee, just behind your knee, if you bend your knee, you'll feel like a cord. Okay, just behind your knee, that's the tendon of the biceps femoris. That's that tendon right there that you're feeling, and that's the biceps femoris. Okay, it's again because it goes across too. It not only does it flex the knee, but it also helps to hyperextend the hip, bring the leg backwards. So that's the biceps femoris. The next muscle I have right here, okay, is a semimembranosus. This purple one here. Sometimes if you have a friend or a neighbor and you say, hey, let me try something, have them lie on their belly, bend their knee up to 90 degrees, hold their leg, and have them try to pull their leg, towards their buttock region, or their shin towards their buttock region. And sometimes you'll see a big ball of a muscle sitting right there, and basically that's a low riding belly of the semimembranosus. So that's a semimembranosus right there. So the semimembranosus is part of the medial hamstrings, lateral hamstrings, biceps femoris, medial hamstrings, semimembranosus, and the semitendinosus. The semitendinosus is on this side, very tendinous. So as I feel on the lateral side of the knee, just above the, on the medial side of the knee, on the lateral side I could feel that tendon for the biceps femoris. On the medial side, if you feel really close and you tighten up your hamstrings while you're sitting there, you'll actually feel two cords. The one cord that's medial is the semimembranosus, and the one cord that's even more medial than that, very medial, is a semitendinosus. So the tendons go from semitendinosus, semimembranosus, and over here biceps femoris. Okay, and those are the three muscles that we have. They're called the hamstrings. They attach all to the area of the ischial tuberosity up in there. Biceps femoris, lateral, semimembranosus, the lateral most of the medial, and the semitendinosus, which is the medial most of the medial. Okay, so that's what we see with the hamstring muscles. Okay, again, you remember there's four, and those four are there's three. The semimembranosus and the semitendinosus are medial. Then the biceps femoris lateral. Now, I mentioned before something about that sartorius that I want to mention. Let me just draw the sartorius in there. I mentioned the sartorius that comes down this way and attached to a common tendon right there. Okay. I also mentioned the gracilis, and this gracilis came down there. That's that second muscle that comes together with a common tendon right here. The third one that comes together is the semitendinosus. So when I talk about the semitendinosus, the gracilis, and the area of the sartorius, they all come together with a common tendon. Now, the common tendon is actually sort of strange because basically it broadens out and looks like this. Looks like that. Almost like a little foot, like a goose's foot. Well, I called it that because they call it the goose's foot, or what's called the pes, P-E-S, anserinus. I won't spell it because I'll go off the screen. Pes anserinus. And it's where the sartorius, the semitendinosus, and the gracilis come together at a common tendon right in this area and stabilizes some of the medial aspect of the knee. Sometimes runners may get what's called a pes anserine bursitis right there because of inflammation of that area. So that's called the pes anserinus. Okay, and there's the gracilis that we see. The gracilis. So the gracilis is this inside one right there. So semitendinosus, gracilis, they're all set there together. Okay, and then the adductor magnus we won't talk because then that's just another of our groin muscles. Okay, now this looking at the side, the lateral side right here, we do see a couple things here. And there's my gluteus maximus. Here's the gluteus maximus. Gluteus medius is sitting up there. Gluteus medius is really an important muscle. It's small. It's, everybody gives the gluteus maximus all the credit. Everybody talks about the gluteus maximus. But what happens is nobody thinks about the gluteus medius. Important muscle. When you get a chance, what I want you to do is I want you to stand up and lift one leg. Okay, and stand there for a couple seconds. I know your balance is going to be crazy, but stand there with your one leg up for a couple seconds, and you're happy. What actually is doing that, and what's helping you to do that, is the gluteus minimus. Gluteus minimus. Okay, and what that does is it attaches to the area of the femur that will actually help to bring it not reaches so much as the femur, but what happens, it goes from the femur to the area of the pelvis, and it helps to stabilize the pelvis. So if I had my leg this way, my leg this way, and here would be my pelvis right here. Once I lift this leg, if I lift the leg, let me see if I could erase the little, I can't erase the whole thing, but if I lift the leg this way, okay, what happens is the pelvis would want to drop. Would want to drop on that side. So the pelvis would all of a sudden drop this way. What prevents it from happening is that gluteus medius fires, pulls the pelvis back up that way, helps to stabilize it. It cranks that whole, because it's attached back in here in the area of the sacral region, and it pulls the pelvis and the leg up that way so that the pelvis doesn't drop. It supports it in a horizontal way. So it's a very important muscle for that reason. To help to stabilize. People who sometimes have a stroke, they get what's called a gluteus medius lurch. And what happens, you see when they actually shift their weight over. They shift their weight over because sometimes the gluteus medius is so weak that it won't support it. So what they do is they shift their gravity over, the weight of gravity over their center of body, center of mass over their good leg, because they know that if they didn't do that, they'd fall. Okay, and the hip would fall, the pelvis would fall, and they'd fall on the ground. So they learn to do that after after probably having it happen a couple of times. So that's the gluteus maximus. There's the gluteus medius up in there. Again, it's really an important muscle. Okay, gluteus minimus is deep to all those, as the sign says right there. There's the tensor fasciolata. Okay, and basically it's sort of here's the iliotibial. Let me draw it in here. Here's the iliotibial band coming down here, and that tensor fasciolata sits right up in here, and it tightens up that iliotibial band on the lateral side of the leg, which is probably the biggest advantage that it has. Okay, and again, what happens is this is the iliotibial band that we see down here, like we talked about, which is in that thing right there. See a little bit of the vastus lateralis, over there, big deal. Okay, we see that just long head of the biceps, femoris, see it down in here. That's the long head of the biceps coming down, tendon down in there. That's that. Let's see what else I got here. That's it. This is just looking at some of the thigh and the cadaver. You can I've actually put a couple of these things together. There's my, there's the vastus medialis. Just go back and forth, and you can see that. You can do that, and you can see what's going on. Rectus Femoris, blah, blah, blah. Here's the Sartorius. You can see how the Sartorius comes across at an angle that way. You can look at that in your own time. This is another one looking at the back of the leg. You can see the hamstrings down in here where they attach. You can see one thing I was going to leave this off. This is actually the gluteus medius up there. Okay, the gluteus medius is that area right there. You can see it sits underneath the maximus, but it's larger than you think. See how it attaches to the femoral head right there. One of the things I just wanted to show you here was this thing right. Whoop, let me get rid of that. What I want to show you was this thing right here. That's a sciatic nerve. Okay, there's a little muscle right here. It's hard to make it out. I don't expect you to know it's right here. It's a little triangular shaped muscle, which is called the piriformis. And what happens is right below the piriformis, there's an opening, and through that opening is where the sciatic nerve comes out. You can see when you look at this, how large that sciatic nerve. It's one heck of a large nerve, okay? And it's because it has a number of nerves inside that whole tract that makes it that big. So that's the sciatic nerve that we see over there. So and you could look and you could compare on the right with what you have on the left. Okay, so let's head on a little bit. Let's talk a little bit more. There's gluteus. I just labeled these for you so you know what they are a little bit more. Let me just mention a few things about the leg, and I'll let you go for tonight. In the area of the lower leg. Okay, I wanted to mention here, I have a little circle that I drew up in here. Okay, and this area up in here is where the patella is. You can see the patella here. You can see maybe the patella way up in there a little bit. But what happens is that patella, you gotta remember the quadriceps come together, they wrap around the patella, and the patella comes and attaches that area of the tibial tubercle, that little bump on the superior portion of the tibia. The reason why we have that patella, which is called a sesamoid bone, which we talked about before, is it actually lifts the quadriceps a little bit off the femur. And it improves their mechanical advantage. Actually makes the quads stronger. If you didn't have the patella, the quads wouldn't be nearly as strong. So that's what I just want to point out at that point. So that's the patellar tendon that we see right where the arrow is pointing to. Okay. Let's look at a couple of there's the patellar tendon again. Let's look at a couple things. Now, if you look at the front of the leg, okay, if you take your hand and put it on the anterior portion of the shin, you feel that sharp edge of bone, which is that anterior tibial crest. If you go a little bit lateral to that and you bring your foot up, you feel how tight that muscle gets. That muscle that's getting tight is this muscle right here called the Tibialis Anterior. It's a very strong dorsiflexor of the foot. Very strong dorsiflexor of the foot. It's probably the muscle that dominates that area of the what's called the anterior compartment of the leg because it's big. Okay, very strong dorsiflex of the foot. People who are exercising, they do a lot of uphill walking, they frequently complain of pain in the front of the shin along over the muscle, not the shin splints. We'll talk. I could talk forever about the shin splints, but we won't. But they talk about the pain in the front, the muscle in the front, and a lot of times it's because as they're walking uphill, the grade of the heel is this way, so they have to dorsiflex their foot more to go up the hill, and they overwork this muscle. This muscle here gets overworked. And that's why it's the tibialis anterior. You can feel it pretty well if you look at. If we look at the area over here, here's the tibialis anterior sitting right there as well. That's a very strong muscle. You know, quite powerful muscle. Okay. Sometimes if in certain diseases where people have a weakness in their foot, they actually come down here, and if you take your foot, okay, and you pull it up, you'll feel a big tendon just on the medial side of the anterior ankle. That's the tendon for the tibialis anterior. Very, very large tendon. They sometimes could actually disattach part of the tendon and swing part of the tendon over laterally to actually bring up the lateral side of the foot as well, just to try to balance out some muscle activity that we might be losing because of some type of a paralysis or something like that. So that's the tibialis anterior or anterior tibial, whichever one. Right next to it is what's called the extensor hallucis longus. Hallux meant big toe, okay? Hallucis, same thing. Extensor, extends it, it brings it up. So when you're sitting there and you bring your big toe up, feel for where that tendon is. Now the extensor hallucis longus is a much smaller muscle. It doesn't go very high up. It's much smaller. It's not nearly as high riding. It actually sits behind this muscle. This muscle right here is called the extensor digitorum longus, and the extensor digitorum longus extends or brings up the 5th, 4th, 3rd, and 2nd toes. Okay, and the extensor hallucis longus sits underneath it, sits way down in that little gutter right down there. You'll feel the tendons. You can actually feel all three tendons. You'll feel the tibialis anterior, huge. You'll feel right next to it when you bring your big toe up, extensor hallucis longus tendon. Try it, believe me. I guarantee it. It's there. I know. I've seen it a billion times. And then if you bring up your little toes, all the rest of the lesser toes, you'll actually feel the rest of the tendon, which actually it comes one tendon, and the tendon sort of fans out into 4 tendons that goes to the 5th, the 4th, the 3rd, and the 2nd toes, and that's a whole process in itself, and we could go on forever, but I won't do that. So anyway, that's looking at the anterior portion of the leg. Okay, and again, when we look at the extensor muscles, we have the tibialis anterior, we have the extensor digitorum longus, we have the extensor hallucis longus, and there's another muscle that's sometimes there. Now it's put in here on this slide, and it's not always there. It may be there, it may not be there. It's called the Fibularis Tercius or the Peroneus Tercius. Sometimes you'll see it in the older textbooks saying Peroneus Tercius. The newer textbooks call it Fibularis Tercius. And basically those are the 3 anterior muscles of the shin. Okay, if I look over here, this is lateral now. Now if you take your foot and turn it out, you'll feel the outside over the area where the fibula is get tight. There are 2 muscles there. There's muscle, and this is going to take rocket scientists to figure this out. So listen really close. Get close to the screen. Put your ear right up to the screen because you're going to need to hear this. Okay. There's 2 muscles on the lateral side. They're either called the peroneus something or the fibularis something. Again, the newer terminology is fibularis. But what happens is one of them is called the peroneus or fibularis, oh get this, longus. The other one's called the peroneus or fibularis brevis. What do you think the difference is between the fibularis longus and the fibularis brevis? Of course, the fibularis longus is long. It starts all the way up here at the area of the femoral of the fibular head and goes all the way down. And what that muscle does, okay, it actually creates a tendon at the ankle. It goes behind the lateral malleolus and it goes underneath the foot and it goes all the way to the base of the first metatarsal, all the way over to here underneath the foot. So it's going all the way from here underneath the foot, and it pulls the medial side of the foot down. Okay, so that's called the fibularis or peroneus longus. The brevis is shorter, and the brevis, if you take your foot, put your foot out, okay, and you feel where the 5th metatarsal, that styloid process, that little bump on the lateral of the foot, you'll feel a tendon coming from there. That's the fibularis or peroneus brevis, and that just everts the foot, turns the foot out. Okay, so that's what that is. Okay, so that's the fibularis longus, peroneus brevis, blah, blah, blah. If I look posteriorly, I only got a couple more things to talk about here. Look posteriorly, Okay, the first thing I have back here, here's the area right here where the medial hamstrings are, medial hams. I put that in a little circle right there, and then over here would be the lateral. So I know that this is the biceps femoris, semimembranosus, semitendinosus over there. I just thought I'd throw that in just for the heck of it, just to confuse you even more. Okay, and if it's about the same time at your house that you're watching this, as I'm doing this, you realize that you should probably been in bed, 4 hours ago. Anyway, so that's that. Gastroc. The gastroc is that huge calf muscle. When you see these guys, the bodybuilders up there, you see those big bulges. The gastroc has two heads. One head that's here. Let me draw a picture here of that. One head that's here and one head that's here. So there's a medial head of the gastroc, medial head, lateral head of the gastroc. But they come together. If you look, you actually see where they actually come to this long tendon or this long area of fascia down here. You actually see a little ripple here, and you see the big bulge here, and you see the big bulge there, and that's the gastroc. Gastroc, since it goes above the knee as well as below the ankle, is quite a strong muscle. It's a very, very strong muscle. Okay, and what happens is it will it's a good plantar flexor. It takes the foot and forces the foot down. Okay, forces the foot down, and it's very strong. And then what happens is when it comes down here, it comes to a combined tendon, and the area of the tendon down here is called the calcaneal tendon, or better known as the Achilles tendon. Okay, so the gastroc comes down, and both heads of the gastroc come down, and they form the Achilles tendon. Well, I want to show you something else I think that's here. Now, what they've done, okay, there's the calcaneal tendon or the Achilles tendon. If I took the gastroc and cut it, let me cut the gastroc with a knife right here. I cut it across right there, and look underneath. There's another muscle that sits underneath the gastroc. Okay, and that's a muscle that's here. It's called the soleus. They sit side by side, like front to back that way. Soleus is deep to the gastroc, which is more superficial. But what happens is somewhere around here, they combine. And if you look down here, we got a lot of muscle belly of the soleus down here, a lot of muscle belly of the soleus here, and they both combine to become the Achilles tendon. Okay, sometimes, remember we talked about the calf. The name for that is sural, S-U-R-A-L. Sometimes they call this the triceps surae, because there are three heads: medial head of the gastroc, lateral head of the gastroc, and soleus. They come together to one tendon that goes to the Achilles tendon that attaches the calcaneus, and that's what we have with that. So that's the soleus down deep to the gastroc that's down in there. Okay, let me get rid of all this my scribbling here. Okay, couple other things I want to show here. There's plantaris. There's a little muscle here. It's called the plantaris. Okay, and the muscle is only about this long. It's a really small muscle, and it has a tendon that's about this long. And if you see this little line right here, see this little line right there? That's the tendon of the plantaris. It actually comes all the way down and attaches with the medial side of the Achilles tendon down by the ankle. I'll tell you, it's essentially worthless. Okay, that muscle doesn't do one whole much of anything. Okay. Sometimes they used to call that the freshman's nerve when people do anatomy, because they cut and said, look at that big thing, that big cord that comes down there, and because the muscle is so small up in here and the tendon is so long, they thought it was a nerve. And it's really not a nerve; it's a tendon of the plantaris muscle. We used to use it sometimes surgically. I know I had a patient who was a deputy sheriff in Lorain County, and she was tough. Okay. Anyway, what happened? She was playing volleyball on this men's volleyball team, and she came down, landed on somebody's foot, and she twisted her ankle, and she had to leave the game. She played for a while, couldn't play anymore, and left. Okay. And so she went to the hospital out in Lorain County, and they looked at it and says, oh, you got an ankle sprain. So they treated her like an ankle sprain. And after about 4 months, she still wasn't getting any better. And she was having as much pain, but she wasn't getting very much better. And she noticed the power wasn't there. So she came and saw me. I felt the area of the Achilles tendon. Basically, the Achilles tendon was torn. It was ruptured. It was gone. And they should have noticed that a long time ago, 4 months ago. They could have repaired it early. So basically, what we ended up having to do was take taking her back into surgery, and we split her open all the way down here, and had to try to freshen up the ends of the Achilles tendon. And because the fibers in the Achilles tendon, they're all run parallel, you actually have to run sutures back and forth like this to be able to hold the tendon. So let's say, let me do this again. Let me say if the tendon is like this, you try to freshen up the edge, because all this was dead in the middle. It was garbage. There wasn't a whole lot there. What we actually did is we actually rotated a piece of tendon down, made a flap, rotated a piece of the tendon down, and then ran a stainless steel wire back and forth this way to hold it together. But we also took and we cut off the plantaris, okay, way up here and down here, brought it out, and because it looks, it's tendon, we fanned it out and we wrapped it around the tendon down here, the Achilles tendon right here, just to provide a little bit more strength, and actually was fine. She did good, okay. But anyway, that's a little bit happy. That's the plantaris, okay. Basically, otherwise, other than being used for other things, it's pretty much of a worthless muscle, okay? People say, oh, they rupture their plantaris tendon. No, if they do, it's not going to cause a problem. They usually rupture the medial hair of the gastroc more than anything else, okay? They have that type of a problem. Down here, this is the deep muscles, okay? Mentioned the deep muscles, and we won't spend too much time. I would love to talk about this for another half an hour, but we've already gone almost 55 minutes on this one right here, and you're probably up, and you've probably been to the bathroom 4 times, okay? But what happens behind the tibia? Remember in the front I had the tibialis anterior, the flexor hallucis or the extensor hallucis longus, and the extensor digitorum longus. They extended everything in the front. They brought them up. And they have the same thing that mirrors it on the back. On the medial side, the most medial side, I have a very strong muscle, which is called the tibialis posterior. Very, very strong. It comes down into the arch, that spreads across the whole bottom of the foot. It's a very, very powerful muscle. I could probably talk about the tibialis posterior for another hour, but I won't do that. I won't bore you with that. Very, very strong muscle. Right next to that tibialis posterior that we get, okay, right next to the tibialis posterior, which is actually very high and swings from sort of central to medial, we have the flexor digitorum longus, okay? Flexor digitorum longus, which is smaller, but what happens goes behind, both of these go behind the medial malleolus. They're posterior to the medial malleolus, and they run down, and then the flexor digitorum longus actually crosses from medial to lateral to go to the 2nd, 3rd, 4th, and 5th toes on the bottom to bring the toes down. Directly posterior, which is the last one back in here, is called the flexor hallucis longus. It's a shorter muscle, and this one, guess where it goes to? It goes to the big toe, okay? It goes down, it goes right behind the ankle, and goes behind the medial malleolus, and then goes to the big toe. So it's almost a straight shot. In fact, once they get underneath the arch of the foot, the flexor digitorum longus, because it's going from medial to lateral, and the flexor hallucis longus, because it's going straight, they actually cross themselves. It's called the master knot of Henry, but you don't have to remember that. Just another little piece of trivia that you could forget, okay? Called the master knot of Henry. But what happens is these sometimes there's a little inflammation. They're in a common sheath, a common tendon sheath at that point. I used to tell students if they wanted to remember what the order of the tendons are from medial to lateral behind the medial malleolus, it's called Tom, Dick, and Harry. So if you remember Tom, Dick, and Harry, you're good. T, tibialis posterior. D, flexor digitorum longus. AN, artery and nerve. When you feel behind the medial malleolus, you'll feel an artery. That's the posterior tibial artery. And then H, hairy, which is the one that's the most posterior that we find. Anyway, those are the deep posterior muscles that we have behind the leg, okay? One more muscle that I just want to mention really quickly is this called the popliteus. It's up there. Remember how I mentioned when we talked about the knee, about extracapsular ligaments. I mentioned the lateral collateral ligament, that cord-like thing you feel on the lateral side of the knee is extracapsular. What separates the lateral collateral ligament from the capsule is this son of a gun right here called the popliteus. The popliteus is a very small muscle. It's probably only about this long, about that wide. It runs from posterior lateral to sort of like medial, inferior medial, and crosses to the area of the tibia in the front, in that area. And what it does, it prevents the tibia and the femur also from going forward and backward. It sort of helps the cruciates a little bit with that. I remember I went to a vacation a long time ago in Quebec City, and they have some huge monster hills, and I was running along the St. Lawrence Seaway, the Citadel, Old Quebec, and stuff like that. And I was running up and down these hills all day long, and my gosh, I had such a bad popliteus tendonitis because my knee wanted to go forward and backward, and it was a mess. Okay, so that's the popliteus muscle. Okay, so where do we go from here? Nowhere. We go to bed. Okay, so anyway, that's a little bit about the muscles of the extremities. Hopefully, there's a couple that I probably left out, like the psoas and the iliopsoas. Psoas, basically, I'll probably show you more when we talk about the abdomen, because you actually see a psoas shadow on radiographs when you get an X-ray of the abdomen. You can actually see that psoas. And the iliacus, we talked a little bit about when we talked about the pelvis. It fills the inside of that iliac fossa. If I look at how the iliac bone came up, it would create like a little fossa like that. The area inside there is filled by the iliacus. When I finally get down to the pelvis, the iliacus and the psoas joined together to one common tendon called the, guess what, iliopsoas. Okay, so folks, hope you had a good time tonight. Maybe you shared it with those close to you at home. It's a great way to stay amused when we're all sequestered in the house. Well, it's probably not, but I had to give you some excuse for actually watching this. But anyway, if you have any questions about this, we'll be talking about this on Monday and Tuesday in our lab sessions. So please look at the videos before. If you got here, you've actually looked at them. So anyway, but look at the videos, and if you have any questions, I'll be more than happy to answer any questions and maybe tell you a little bit more nuances and tell you more fun facts about the muscles that we talked about in these last two videos. So anyway, besides that, hope everybody's staying healthy, staying safe. Tell those people around you that you love them, and make the world a better place to live in. And we'll see you all next week. So be good, stay safe, stay healthy.